The Mental Health Association of Greater Springfield has been supporting people impacted by mental illness, developmental disabilities, and homelessness, and those struggling with substance abuse for 60 years. Carloee McGrath sat down with President and CEO of MHA to learn more about their services, and in particular, services for those with intellectual disabilities and brain injuries.
MHA is really a full-service program. We provide services to people with intellectual disabilities, with mental health, homeless people, and we have a continuum of residential supports and in-home supports. We started about 60 years ago as advocates for people who lived in the Northampton State Hospital, and then there was the whole deinstitutionalization movement, and we started opening up group homes and taking people into our homes. We actually have people in our group homes now who have been there for a very, very long time, some of them.
And tell us some of the, actually, first of all, if you could define for us those who might have an intellectual disability. Give us the range of what we're talking about.
So an intellectual disability is really somebody who has some kind of impairment cognitively. Usually it's diagnosed before they're 18 years old, and it might mean that they aren't able to be able to articulate what they want. They might not be able to take care of money. There's such a wide range. And it goes right into developmental disabilities, which might also include physical disabilities. An intellectual disability is actually a developmental disability. It's kind of under that umbrella. And we work with people who have both of those things.
So you have both group homes and you also have outpatient services as well?
For our intellectual disabilities, we call them in-home supports. So it's really kind of a supported living for people who live in the community by themselves or with their families. And we have people who will work with them doing whatever they need, if it's, going to doctor's appointments or helping them with budgets or whatever it happens to be. And some people might need help an hour a week. Some people might need help 10 hours a week. And whatever it is, we sort of identify that and we work with them in the community. Our goal is always to help people to get to their most independent living situation that they can.
And that can be a challenge. And I know that some families who I have spoken with, the big concern is after kids age out of the school services. Obviously the worry is, who's going to take care of them? Where are they going to live? Can they get a job? How do you help people navigate, through that territory?
We actually will help them do those kinds of things. The people that we provide services to in those are actually go through the Department of Developmental Services in Massachusetts. So that's a really good place to start to see if your loved one has the ability to get those services. And then it's just a matter of how independent they can be. Sometimes they can live at home with the family but get supports like somebody from MHA to help them navigate their way through.
And I think one of the issues is too, as we had talked about before, is if their parents are starting to age as well, who's going to take care of them? That has to be an issue that comes up a lot.
That is a concern so much of so many of the parents who are taking care of people of their loved ones with disability is, who is going to do this after I die? And actually in Connecticut and Tennessee there was a law passed that if somebody has developmental disabilities and their caretaker is over 80, that they get services. But it's always a conundrum because somebody has to take care of that person.
Right, and it's a big challenge for families, of course, who need the support. Has the stigma changed over the last few years or several years? I know obviously it has in some degree, but we have a long way to go as far as perhaps people's reaction, whether it be in the school system or in a workplace if you see somebody with an intellectual disability. How do we work on that?
I think, just like you said, I think it has changed, but we still have a long way to go. One of the things that we do is we really focus on community integration, and that doesn't mean getting the participant with the intellectual disability into the community with other people that have the same kind of a disability. It means integrating them into the community in regular kinds of things, which is the great thing about handicapped accessibility, because that's, there's so much handicapped accessibility now. So we try to get them to restaurants or to shows or to, just regular things that you or I would do. And hopefully people start to feel more comfortable around people that have intellectual disabilities.
And what kind of difference do you see in some of the people that come, through your organization as far as the progress that they have made? Could you share with us any stories about that?
There's so much. I just see the differences every single day. And we have such a really compassionate staff. We were talking earlier sort of about acquired brain injuries. And I was at one of our houses that is for people with acquired brain injuries. And I went to her. They've been really in nursing homes for the last several years. That's where the state has been placing them. But now they're being taken out of nursing homes and being put into group homes. So we've opened up several of them. And one of the women was sitting down on the bench. She had just gotten there, and I sat with her and introduced myself because I hadn't met her yet. And she had only been there 3 days. The home had been open for 3 weeks. And she said, I've been in a nursing home for 3 years, and I had no hope of ever getting out. She said, my family wanted to take me and take care of me, but I couldn't let them do that. She said, I got to pick the color of my room. She said, I am so excited to have a home again. And in talking to her, I found out that she loves to cook. And so now she does a lot of the cooking, and she's actually teaching the staff that doesn't know how to cook. So it's, you just hear these things all the time. It's amazing the work that happens at an agency like MHA.
And you have a nice personal story as well. Tell us a little bit about when you were growing up.
So my mom was actually a shared living provider. So we had 2 women that lived with us for a long time that had developmental disabilities. And they were just a part of our family. They came to our birthday parties. We had birthday parties for them. And MHA has a continuum of care for people with intellectual disabilities. So we provide residential program for those that really need that kind of support. We do in-home or supported living supports. And we also do a shared living program where people who are able to sort of live with a family, like the people that lived with us, can do that, and they just become a part of that family.
And how would you recommend that we move this forward, that we just continue to change that stigma that might be out there? Do you have suggestions, for schools, for parents? Like, how do we, kind of break down those barriers?
I think it's to include the people with intellectual disabilities with everybody else. It's that community integration and piece, because that's what's going to make people comfortable. And for people to understand that you just talk to them like they're people, because they're people.